There again, he's feeling it. You know, it's most coming in the mouth. Unfortunately, you won't have a sucker like this at home.
Right.
But rather than using a sucker at home, when his mouth fills up, just stop, and he can spit it out of his mouth. No problem.
Okay.
And you do that, and you want to do it
in the front and the back.
On the front and the back side. You can kind of move it around. When you move it around, it'll be a little uncomfortable. But essentially, you just want to make sure that and what you'll do is you'll use essentially 3 of these full of water 3 times a day.
Wow. Okay.
Okay. So we just did one. It takes like 2 minutes. So I mean, it'll take like 5 or 10 minutes to do it. It won't be a huge time commitment. But you got to do it 3 times a day.
Okay.
And that just helps to keep everything nice and clean. We'll send you home with a whole bunch of this gauze. Yep. With a whole bunch of gauze.
Okay.
And then this little stretch net, it's more like just like a tube, and you stretch it around and it'll go around his head and hold the gauze in place. That way, when it's oozing, it's not leaking all over the place.
Gotcha. Stretch net. Gotcha.
Yep. So you can put it around if that's comfortable enough, or you can pull it up and bring it so it's coming around your head. Whatever's comfortable.
Okay.
I mean, you could bring it up like this if that was better. And then you can just pull a hole in it, and then
okay. Right here. Thank you.
Put his ears through.
Put his ears through.
Okay.
Yeah. If that's more comfortable, totally up to you. Whatever it does. This isn't. I mean, critical. This is just to keep it so that it's not leaking and making a mess.
Sure, that makes sense. Okay. Wow.
Okay.
Yeah.
Antibiotics 3 times a day. So when you take the antibiotics, irrigate it out. That way, you're getting everything. Doing it all, making sure we're getting it all done
at one time. Okay. That
Yep.
makes sense.
Did they give you pain meds with the ED?
They didn't. We'll give them.
Okay.
We'll give you enough pain meds to keep you comfortable. You'll be a little bit sore, but you'll get better.
I got holes in my face.
What's that?
I got holes in my face.
You have a hole that's about that big, and I anticipate that when everything heals up, you'll have a scar that'll be a little bit noticeable, but it'll be that big. Okay? And so that tube in there, the most important thing that tube is doing, well, 2 really important things. One is it's keeping that hole from closing up and having that infection reaccumulate. So it's essentially a tract that things can just continue to drain out. And then 2, it's allowing us to have a means to be able to inject the saline in order to keep it nice and clean and flushed out. We need you to brush your teeth. You can brush your teeth just like normal. Brush. Keep them nice and clean.
Have you guys had Vicodin before? Have you had Vicodin ever?
I'm not sure.
It's like a narcotic pain medication.
You haven't had much of
I
that.
heard of it. I think I have.
Or like Percocet or something similar to that.
Yeah.
Yeah, this is Vicodin is basically that. You can just do Vicodin. It's good. Okay. But yeah, so we'll give you a prescription for that, and you can do 40.
Okay.
Don't take Tylenol with this pain medicine because it has Tylenol in it.
Gotcha.
Yep. But you can take ibuprofen with it. That's no problem. Aleve. Aleve is. I mean, it's a good pain medicine, but I wouldn't take Aleve, especially if it gives you an upset stomach.
Yeah, we're done with Aleve.
Yeah. Don't drive. Don't make any important decisions when you're taking this narcotic pain medicine because it can make you a little drowsy, not think straight.
Like the morphine did.
Very true. Yep.
Yeah.
Not quite the level of the morphine, but it'll last longer than the morphine, but it won't make you near as loopy as the morphine did.
Gotcha. Okay.
Are you hurting at all right now? Your lip's going to be numb for 4 to 5 hours. That numbing medicine we put in there is long lasting. And like you'd said that it felt a little different even before we got started. That will probably still be present for, who knows, 2-3 weeks just as the body heals and gets rid of that infection. And then I anticipate, no reason to believe that this will be a permanent weird feeling. I anticipate that this will return to normal after 2 to 3 weeks, maybe 2 to 3 months at most.
Okay, so just to make sure, so I guess in 8 hours we need to unwrap this whole thing, take off the gauze, and then give him his pain medicine, give him his antibiotics. We need to get that
We'll see more about it and see what it looks like.
that tube thing, fill it up with water to where you said, and then spray it in, even moving it around a little bit in the front. and also sticking it in the back.
Yep.
Moving it around the back. He may have to spit and whatnot, but he has to be able to feel the water coming in.
That's important. Yep.
Yeah. So that he feels water coming in, and then once we're done with that, we put gauze back on it, put the little wrap thing back on it, and that's it. Cool.
Yeah. So you'll do, so we'll say, we're doing it now. And then, if it's 7 hours, yeah, so be it. So if you're getting tired, it's 10, 11 o'clock, and you want to do it and go to bed, that's fine.
Okay.
And then if you wake up and it's, 7 in the morning, so it's been 9 hours or something like that, that's fine.
Okay. Cool. Cool.
Yep, and use 3 of those big syringes, 3 of those full 3 times a day.
Okay.
3, 3, 3, 3, 3, everything's 3.
Gotcha.
Except for the pain medicine, you can take that every 4 hours.
Okay.
The instructions are on there.
Cool. We're gonna get that filled now.
Good.
Indeed. Wow.
And you already got your antibiotics, so continue taking that 3 times a day, just on the schedule.
Sure.
If at any time this gets worse, so today essentially you were able to open, it wasn't painful, you were able to breathe, no problems. You said that when you swallow, sometimes it felt a little weird, but by and large you can still swallow. You were able to eat some Taco Bell last night. Granted, you threw it up, but that's probably from antibiotic or something on an empty stomach. But anyway, if at any time you're starting to feel like your throat's closing up, like you can't breathe, or you're starting to have really tough time swallowing, like you're drooling because you can't swallow your own spit, anything like that is an emergency, and you need to come to the emergency room here, the emergency room Wake Med, somewhere soon, and be assessed. Okay?
Okay.
I don't anticipate that, but on rare occasions it can happen if this infection,
Sure.
is if you just if you sit on it, which we didn't sit on it, we drained it. So, what questions do you have? Did you park at the hospital garage over here?
No, we drove into the emergency room, so they valet parked for us, whatever.
Okay.
So we had to go back there.
If you want, so this road right out front here is the main road. The road that you turned off of to go to the emergency room,
Right.
and then the same road that if you were to continue straight up, you
So
go
Manning
past the
Drive.
hospital, Manning Drive, exactly. And if you just continue on Manning, and you can pull up right out front here.
Okay.
That way he doesn't have to walk if you want.
Okay. Yeah. That'd be
If you
fine.
want to walk, you're more than welcome to. There's no reason that you can't, but if you want to walk, that's fine.
I'm gonna walk.
Okay,
Okay.
that sounds good.
Cool.